Guys, welcome to the next chapter, chapter number 12, which is the disease for skin and subcutaneous tissue. The course series starts with L. Here we have few guidelines with regards to pressure ulcer. We'll be learning in detail about pressure ulcer. Pressure ulcer as well as non-pressure ulcers. We'll be learning in detail about both the categories. The guidelines are pretty similar, but we'll start with pressure ulcer guidelines. As you all know that what does pressure ulcer mean? In medical terminology or as per medical coding documentation, the pressure ulcer might be documented as pressure ulcer, decubited ulcer, sore like that. Here you need to focus couple of things. What you need to focus, we'll learn step by step here. First one would be whether the documentation of stage of the pressure ulcer is there or not. Before discussing about that or before learning about that, let me give a quick overview of how many stages we have. In total we have 4 stages, 1, 2, 3, 4 and unstageable as well as unspecified. We'll discuss about unstageable as well as unspecified. What does it mean? But let me give an overview of stage 1, 2, 3, 4. What does 1 mean? 1 means pre-ulcer. The skin starts hits rashes or ulcers. Initial stage, which is called as pre-ulcer. Second stage, it's like abrasion as well as blisters. It seems like that. And stage 3 would be full thickness over the skin. It will be till skin and subcutaneous. And stage 4 would be which involves muscle as well as bones, right? So here we need to discuss what does unspecified as well as unstageable. It seems both are same, right? Do you have that question? Both are same? No. I'll show the difference. Unspecified means the physician has not documented the stage. Just he mentioned pressure ulcer elbow, pressure ulcer buttock, that's it. He has not mentioned the stage. In that case you will be going with unspecified. Then what does unstageable mean? The physician should document the pressure ulcer is unstageable. That means he is unable to justify whether it is stage 1 or stage 2 or stage 3 or stage 4. That's the reason he will be mentioning unstageable. Here the characters matters a lot. For stage 1, 2, 3, 4 there's a different. For unstageable we have different. For unspecified we have different. You need to be more focused on that. Let's come back to pressure ulcer. What does pressure ulcers? We just now learned that we have some stages. We have 1, 2, 3, 4 and unstageable and unspecified. These are as per coding, right? As per codes. We'll go in detail about as per guidelines. What does guidelines? What the guidelines states? First guideline is stages, pressure ulcer stages. Let me give an example. If a patient has decubitus ulcer of buttock stage 2 as well as decubitus ulcer of buttock stage 3, decubitus ulcer of buttock stage 4, which one we need to go? Do we need to code 3 codes or do we need to code 1 code? How we will be coding? Here is the guideline. As we have discussed already in glaucoma as well as malnutrition, let me reiterate once again, we will go with severity. We'll go with higher severity. Here the higher severity is stage 4. We will be coding with stage 4 decubitus ulcer buttock. Fine. This is how we need to look into the stages. Next, unstageable pressure ulcers. Already we have discussed, right? What does unstageable means? Unstageable means the physician itself not documenting. There is no clear clinical documentation. Physician has not documented any stage. Physician has documented there is nothing about the stage, just he mentioned unstageable. In that case we will be going with this. Next, documented as different stages. What does it mean? When the patient is admitted to the hospital, the stage was 2, and after 2 to 3 days the stage was progressed to stage 4. In this scenario, do we need to code pressure ulcer 2 with POI Y as well as pressure ulcer N? How we need to code this Y and N? Usually you will be referring for IPDRG, not for you. I just give an tip for that, how we need to code. But here we will be coding only stage 4. Only stage 4 we will be coding. No need of stage 2, because as I mentioned, the greater stage or the higher stage we will be taking. Next, if the documentation states pressure ulcer healed, do we need to code or not? If yes, how many codes we need to code? If you encounter a documentation stating that there is an healed pressure ulcer, don't code any condition, don't code any diagnosis for it, because already it states healed. That means cured. No need of coding that particular ulcer or particular decubitus or particular pressure ulcer, whatever it might be. Next, if you encounter or observe any documentation stating that healing, pressure ulcer healing, how we will be coding? If the documentation states healing, in that case you can code. In that case you can code pressure ulcer of the site as well as stage, whatever might be the stage. For all the pressure ulcer you will be coding 2, stage as well as site.